Hi, everyone. This is day 5 of the Tiny Feet Big Steps conference, and we're busy today talking to lots of lovely people. Here with me, I have Dr. Sharla. Could you please introduce yourself, give us a background of who you are, and whether it's your first time here at the conference?
Of course. So my name is Sharla Rent. I'm a neonatologist at Duke University in North Carolina, and I have a research appointment also at the Duke Global Health Institute. And this is my first time at the conference. I'm very excited to be here.
Oh, wow. How did you get to know about the conference?
So Duke has a partner site in Moshi, which is about 2 hours down the road. And I've been working there for really since starting during the pandemic and then kind of came over as soon as the pandemic was over. So had heard about this conference a little bit from people at KCMC. And then I'm also friends with Dr. Scott, who's one of kind of the main organizers, who's been encouraging me to participate for a couple years, and I was finally able to make it work.
That's fantastic. Looks like good networking, sounds like.
Fantastic. Yeah. I know a handful of the US-based neonatologists that are here, but not all of them. And one of the best things has just been meeting all the neonatal providers from around Africa, because most of them I didn't know before now.
So what kind of work do you do in Moshi?
So in Moshi, I focus on perinatal palliative care, and then we're starting to look at maternal mental health as well. And so I'm looking at how do we support families after a neonatal death? How do we have difficult conversations with families? Even also I have some amazing OB partners. And so how do we think about stillbirth and supporting families around stillbirth as well?
I really appreciate that about this year. The thing I appreciate about this year is that there was quite enough obstetric input, even in like the sessions. And yeah, that's always important to remember the mother. It's not just about the baby, but what's the mother going through? How can we help the mother? So it's great that you came in with that perspective.
Yeah.
What were your sessions like?
Yeah, so I had the honor of doing 3 sessions, which was fun. So I did bereavement, which was also incorporated like difficult conversations and communication. I did one on maternal mental health, and then I did one on palliative care and ethics. So all kind of related in this, that it has this very humanistic kind of person-centered approach and less on the hard science, but also kind of like distinct lenses where we can view how do we support families.
What were some of your key takeaways from, I know that's a lot that you offloaded on people, but could you just share a bit of the things you shared that would be good to know?
Yeah, honestly, like the best thing was just having it be a topic of conversation to kind of take place, because I think so much of our focus is on saving babies' lives, which like, yes, absolutely, let's do that and let's optimize care. But I think not, like to your point too, like not forgetting the mother, not to remember to keep the family central. And, kind of some specific things. I talked a lot about seeing and holding the baby around the time of death. So with neonatal loss, that might be kind of as the baby's passing away, or if a baby's not going to survive. But even with stillbirth, kind of letting the family take pictures if they want to, hold if they want to. Another key point too was bringing the father into some of those experiences. I think so often we think of the mom and the baby, but there's another parent as well. I also kind of tied that into the mental health conversations we were having. So recognizing that mental health challenges arise during pregnancy, postpartum, things like PTSD closer to a month after, and prolonged grief even a year after. And that fathers are more at risk for depression if the mother has depression as well. So thinking about how by supporting the mom, you're supporting the baby, you're supporting the dad, but also let's screen the fathers as well.
The father input, that's something that people don't really talk about much. So yeah, I appreciated that side of your presentations. And also considering that we are on the African continent, there's also those cultural implications when it comes to mental health issues and also maternal. I understand that, of course, you make sure that you do your research with country-led representative. How do you make sure that there's sort of balance there?
Yeah, so everything is in, I don't even want to say partnership, because I'm kind of the follower in how we design a lot of the work. But at KCMC, for example, I have 2 amazing partners, Dr. Aisa and Dr. Razia, who are a pediatrician and an obstetrician. And together we designed like all of the research tools, all of the research guides, all of the questions that we think about when we're going to talk to families. Any conversations directly with families are by a Swahili woman, one of our research assistants, Gertrude. And just kind of putting myself on the outside, more of the observership, and thinking, helping kind of design some of the questions, but not being the one to interface as much. And I've learned a lot, so a lot of the literature also talks about how women might be at higher risk for abuse, abandonment, isolation after perinatal loss. And we found, though, talking to women, a lot of them say, no, my partner actually was very supportive, or my partner is also grieving and needs some help. And so kind of seeing what people are saying on the ground being a little bit different from what I've read in the literature is really eye-opening too.
Yeah, more so on this side of the world where sometimes fathers get a bad rep.
Yeah.
The father figures are mostly seen as the not so helpful partners in that partnership. So it's good that your research also exposed that men are also helpful and they grieve too, and they can also be depressed.
And even here, so obviously we have physicians, nurses, we have men and women like other providers at this conference. And after my talks, people have been coming up to chat with me, both about like an interest in the research elements, but also to share their own experiences. And so there have been both men and women who came up and said, I struggled, or my wife, my partner struggled after we lost a child. And what you're saying is exactly right, that we don't talk about it enough, and you just go home to suffer alone. And there really should be something where someone from the healthcare team talks to us like after we've had like a stillbirth or a death. But even just normal but like postpartum mental health challenges without a loss.
Yeah.
My particular research focus involves perinatal loss, but obviously most of the postpartum depression occurs in women who don't have a loss. And so I liked how comfortable people at the conference were about coming up and saying, this happened in my own life, and sharing that.
Yeah, that's powerful. How do you think other African countries can start to ask the questions about perinatal loss and perinatal health and postpartum depression? Where do you think they should start from?
I think, like, exactly as you're saying, by asking the questions, right? By being like, well, what do our cultural norms say about these conditions? Like, what is it that our grandmas taught us? And do we really agree with all of that, right? Do we really agree that you must suffer in silence? That if you ask a question about why the loss occurred, that you're putting yourself at risk for a future loss because you're questioning God. And there might be some of us that still feels really true. And you're like, yes, we should kind of make sure we're aware of that as we're talking to women. And there might be stuff where you're like, well, no, maybe we have a place to push a little bit, right? Maybe we have a place to ask a family, would you like to hold your baby as they pass away? Would you like to hold your baby even though they're stillborn? And they might say no, or they might say yes. But I think across a lot of the countries in Africa, starting to ask the questions of how you can start to extend into that space, I think a lot of people are kind of eager to start doing that.
Really great that that perspective was brought here, and the fact that you do have that experience through working with country reps. Do you think you come again next year?
I hope so. I would love to change it up a little bit and have it be more interactive as opposed to lectures. Like, I would love to sit down with a group of nurses and doctors kind of in smaller groups and almost troubleshoot how we start to incorporate this into people's setups, as opposed to kind of me just lecturing from a podium. But I think I have learned so much just from being here, and I can tell that people have learned a lot by kind of the spark in conversation that the topics I brought this year generated. So I would hope to come back.
Yay, yeah. That's amazing. Lastly, looking at maternal mental health, perinatal loss, what are your hopes for the research space around that, the questions being asked, as someone who's an observer?
I think, one, I would love to see a lot more research coming out of Africa, like African-led research around how prevalent this is, how does it present in our cultures, and really a lot of like implementation science stuff around how do we recruit women back to engage in mental health, like peer group supports, or engage in mental health care seeking. One of the things I shared in my talk is just how there is nowhere near enough psychiatrists and psychologists to provide like high-level mental health support to the people who need it. And so I would love to see more research in the space of, well, what are like the adaptive approaches that work with the particularly vulnerable population of like new mothers.
Great. That's a very well-rounded response and perspective on where we could go with mental maternal health in the African continent.
Yeah.
Thank you so much for this conversation.
Of
Thank you
course.
for having this talk. Yeah, it's day 5 again. Sad to see the conference end, but it's been
know.
a lovely experience.
It's just been the best. Yeah.
Thank you.